details on the situation there. We're speaking now with Filipino health worker Lorena Vivas of the New York State Nurses Association for Mount Sinai Hospital. Lorena, thank you so much for joining us. Give us an update on what is the current status of this ongoing strike of nurses in these two major hospitals in New York.
Hi, good evening, Rico. Currently, today is day 2 of the strike for safe staffing. This is taking place in my hospital, Mount Sinai Hospital in New York City, and the other hospital that is striking is Montefiore Hospital, which is in the Bronx. Together, we employ about more than 7,000 nurses, and again, as I mentioned, this is day 2 of the strike.
Day 2 of the strike. Are you getting any closer to an agreement when it comes to safe staffing, Lorena?
Unfortunately, no. I know Montefiore yesterday had, during the strike, that the management reached out to them for another round of negotiation, and nothing was reached. For us, they haven't contacted us to sit at the table again, and we will see. It's only 8 o'clock in the morning here for day 2, so we haven't heard from them, basically.
7,000 nurses caring for a lot of people who were sick in these two hospitals. How many of these nurses are Filipino Americans, Lorena?
I can only speak for Mount Sinai.
Yeah.
We have at least 700 Filipino nurses.
700 Filipino nurses, and have all of these Filipino American nurses joined the strike, or have some of them held out?
Yeah. I honestly don't know of anyone who crossed the picket line that's Filipino. Just to give you context, right? This strike is decided by the whole nursing membership. We presented them what management wanted to give us, and we held a vote. 99% of the currently employed nurses at Mount Sinai Hospital decided to strike. So I'm part of the executive committee. There's 9 of us representing them. But of course, we have to act based on what their constituents wanted. And so this is what they wanted. They vehemently refused the contract that's being offered. And we gave them 10 days to amend it with what we wanted. And no agreement has been reached, and hence this is day 2 of the strike.
Are you and your fellow Filipino nurses at Mount Sinai willing to strike in the long haul to get what you want in this agreement with authorities?
Absolutely. This is something that we feel very, very strongly about. It's not even about wage. The wage that they're offering, we are very likely to accept that wage offer that they're offering, despite press releases sent by the hospital that we are rejecting a 19% raise. That is not the case. The fight here is not the wages, but for safe staffing. What people have to understand is we have an anomalous 550 nursing vacancy, and that is considerable for a hospital. It is not because of COVID. I wanted to make that clear. We have been systemically understaffed by the hospital for the past 6-7 years, and the reason for doing this is it's the easiest way to maximize the profit line. And for years, we've been meeting with them. We've been begging them to have better, safer staffing. But, our demands have fallen on deaf ears. And we took over the executive committee 2 years ago. We've been working really hard with them, trying to educate them why we need it. And still, they preferred profit over patient safety. And hence, now we're here at where we are right now.
So give us an example in Mount Sinai Hospital of the understaffing in hospitals, especially for Filipino nurses.
It is very severe. Just 550 vacancies is no joke. If you're in the emergency room, I represent nurses that they go on their shift and they have 20 patients each. How is
Wow.
that humanly possible or even anywhere close to safe is beyond me. Um, in my ICU, I work in the neurosurgical intensive care unit. We take care of aneurysms and post complicated brain surgeries. We are only supposed to handle two at a time, and that's the legally safe standard for this country. We are constantly being tripled or quadrupled during break times, even if you even get the chance to take a break. A lot of the times we work straight 12-hour shifts with no breaks because I cannot, in good conscience, leave two of my patients to another nurse to even have a proper lunch break. This is how bad it is. And also, we have at least 2, 3 nurses staying over, working 24 hours because we don't have the heart to leave and to go home and leave the next shift short. It's the same for pediatric ICUs where they're only supposed to have 2 per nurse. A lot of times these nurses take care of 4 really critically sick
But Lorena,
babies.
but
It's
Lorena,
bad.
what about, okay, I mean, 20 patients per nurse. I mean, the Filipino American nurses are
In the
indeed
emergency
overworked. Yeah, I mean, as one example. But are Filipino film workers also getting full benefits? Are you getting a proper pay from these New York hospitals?
We have health insurance that they threatened to cut, by the way, during the negotiations. And of course, I, as one of the representatives of the union, fought for it to be reinstalled back, which they did. As far as pay is not at par with the rest of the hospitals, hence the 550 vacancies. If let's say Presbyterian, which is right across Central Park from us, they earn an average $9,000 more. So if you're transferring to New York City, why wouldn't you want to work there? They have less than 100 vacancy. They're paid on an average $9,000 more.
Right.
And
Okay.
this creates a cycle of why we don't attract new nurses coming in. And we've been
Yeah.
trying to tell management, we've been trying to help them concoct ways to make Sinai the place for new nurses. And it's fallen on deaf ears.
Well, Lorena, we're hoping that a resolution will be coming up sooner rather than later, and we will be speaking to you once again when a solution and an agreement is signed between authorities and the striking nurses. Thank you so much for joining us from New York City, Filipino nurse Lorena Vivas.